Tennessee is getting hit hard by an early and intense flu season. We are one of only 4 states in the CDC's highest category for flu activity. What's behind this surge and what does it mean for your Thanksgiving celebration? Here's News 2's Adam Mincer.
It's the season of giving, but doctors want everyone to keep their germs to themselves.
Our big concern is that we're going to have this triple-demic of high levels of RSV, flu, and COVID circulating at the same time.
Dr. Antoon says RSV cases are plateauing in Middle Tennessee, while flu cases are on the rise.
This is the most severe flu season we've had since the 2009 H1N1 pandemic. There are many children who are 2 and 3 years old who have never been exposed to flu or RSV, and the viruses are playing catch up in these kids.
However, when you hug grandma and grandpa on Thanksgiving, that could be putting them at risk too.
And it's an under-recognized cause of lower respiratory tract disease in the elderly. And so just like flu, we see the biggest burden of RSV in the tail ends, in the kids less than 5 and people over 65.
Antoon studies the flu and says even though it's hitting us earlier than usual, we aren't sure what that means for the new year.
What's going to happen with COVID, whether that's going to start peaking in the winter like it did last year, or if it's going to be outcompeted by flu and remain low this year.
And while many hospitals are at capacity around the country, the doctor says Vanderbilt is busy, but there are beds and ventilators available.
One good thing that came out of the pandemic is we did an excellent job, I think, here at Vanderbilt of streamlining a lot of our services in the emergency department and within our hospital.
Yet what the rest of the winter looks like is still unclear and depends partly on how people behave this holiday season.
Back now with Adam. There are precautions we've heard about with COVID the last couple of years. Wash your hands, cover your mouth, you wear a mask maybe, but there are things you can do to stop the spread of germs.
Exactly, Bob. And there's a few things that Dr. Schaffner with Vanderbilt told me he and his family are taking and doing tomorrow. One, rapid test before that meal starts. And of course, keeping a lookout for coughs, sneezes, coughing into your elbow. He also recommended grandparents going around the waist for a hug instead of a lot of kisses. Kind of gives that separation between your face and the child's face. And of course, if you haven't gotten your flu shot, doctors say it is highly effective this year.
Want to get through the holidays safely.
Exactly.
Thanks, Adam.